So Ruby, I'm just going to turn you this way. Ruby has a few things on her forehead that do need addressing. I don't have any current on. I'm not stepping on the foot pedal. I'm pointing out that she's got some clogged pores, some fibromas here, fibromas there, a sebaceous hyperplasia here, a few, I can feel these little fibromas or raised, the keratotic areas where the skin begins to clump on each other. And again here, another fibroma. So let's just see how we're going to treat those. Okay, Ruby, I'm going to give you a little touch just to make sure everything is good for you. I'm going to just address that tiny little brown spot here, just so she gets a feel for this. My foot's on the pedal, and I'm just going to tap, 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 tap. Ruby, how was that for you?
It was just like a little tingle.
Okay, good. Well, if anything tends to bother you, let me know. Okay. We use the witch hazel on the dry irregularities, just like in the manual. I'm going to tap, 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 tap. Okay, now that's treated. I will wipe off one or two of these fibromas as we go. What I don't want people to do is to treat things and wipe them away. As technicians, a nurse, esthetician, we're treating the epidermis. We don't want to wipe it away. We want it to heal easily on its own. So we don't want to remove. We're treating, we're going to let it dry up, and then it's going to fall off, be a little pink, and heal very nicely. Now here's your sebaceous hyperplasia. We're using the same probe. On the card, it says to move in a clockwise manner, tiny little circles. I'm on the correct intensity, and this might ouch just a little bit more, Ruby. What's happening is the probe is not getting hot, but the high frequency is attracting the sebum in the sebaceous hyperplasia. So as it does that, it heats it up. So it may feel like it's getting warm, but it's just the sebum inside that gets warm, not the probe. So I'm just going to give you a touch here. We're making tiny little circles. Is that okay for you, Ruby?
Yeah.
Okay. So the current is off of here. And what I did was I went in a circular fashion. Circle, 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 and one in the middle. You heard it sizzle. That was the sebum getting hot. So it comes out through the skin. It'll appear white like this. At some point in time, it may even look like a tiny little chicken pox because the sebum is coming out of the skin. There's a little void, and now you're going to have an area that might look a little dished out, but the skin closes over and heals beautifully. So, okay, so here's another fibroma right there. Little witch hazel on these dry lesions. Okay, and again, we are going to tap, 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 tap. You want to be very methodical. You don't want to tap all around. You want to do just like a microdermabrasion. No current on it this time. You want to take it this way, give them a rest, give them a rest. And so with this fibroma, I will wipe it off to show you that it just comes off right on the Q-tip. But we don't want to do that with every one. That protective coating is its own little Band-Aid, but I wanted to show you that it completely comes off. Okay, so Ruby, I'm just going to turn you this way. As I work methodically on the side of the face, I will work here, here, just like I was doing a microdermabrasion, as to not skip any spots or go over any spots.